Hello guys and welcome back to my channel, and thank you so much for subscribing my channel. Like really it motivates me to make videos and really to help people. So firstly, as I said, that recently it's been 2 months that I've cleared my OSCE, and I have been getting comments that they want to contact me. I'm really very sorry, it's not like possible to directly give my contact number to you all, but one thing you can do is I have recently opened my channel on TikTok as Manju. You can just go through my channel, or I'll just add my TikTok like link to the description. Okay, so directly you can come there, and I'll just plan a live one day so that directly on live we can have a open conversation so that people can understand what actually it is like there. That is how we can clear each other's doubt. Okay, so I think that will be really helpful. That is the reason I recently like opened my TikTok account. So yes, so now will start the channel. So now, okay, so now today I'll be starting with the silent skills. Okay, so in silent skills we have basically four topics. Okay, so in silent skills we have first as bubble assessment. Okay, so now I'll be just telling you, I won't be able to tell you in depth. Okay, but if you need any like any such videos or any like prescription or non-prescription or clinical skills, any video in detail, please just write it in the comment box. If I get time, I'll make sure that I make a video for you all. Okay, so I've like prepared my notes so that I'll be able to be more clear. So today we will be doing silent skills. Okay, so basically in silent skills we have four. That is, first is bowel assessment, nutritional assessment, oral care plan, and pressure area assessment. In bowel assessment, you usually get a stool, like I told, you'll get a stool picture. Okay, so let me tell you, the stool picture will be a real stool picture. Okay, so they are not going to give you any like animated stool pictures. So be aware of real stool pictures, like how a real stool looks like literally you have to go to your Google and you have to type to how does it look like. You literally have to type and see. Okay, so that will be really very helpful when it comes to bowel assessment. So there are few like things which we have to do, but if you, again I'm saying, if you need any kind of detailed video in any of the topic, be very open, just write it on the comment box, and the next day I'll make sure that I'll make a detailed video on that. So first, as I said, bowel assessment, you will just get one stool picture. Be aware that you will either get constipation or else lose stool. Okay, so I don't remember actually, but let me check. In bowel assessment, basically they will give type 1, that is severe constipation, and type 2, that is mild constipation, severe diarrhea or mild diarrhea. See, I have seen many of my friends who had some kind of like they had some kind of doubts regarding constipation and diarrhea. There are people who said that it is quite confusing, but like they were not aware of the real pictures. Okay, so for me, for you all, like my suggestion will be bowel assessment, be aware of the real pictures of the stool, how real stool looks like. So either you can get type 1, type 2, type 7, type 6 or type 7, only 4. Rest of the between like stools are all normal, so you will only get type 1, type 2, type 6 and type 7. Okay, so according to that you just have to write a nursing care plan and causes. If they write like if they give you a condition like a patient is having this, then you can write causes from that like that situation only. But if you don't get any kind, like if they do not write anything, mostly they do not write anything. Okay, they'll just give you the stool picture. In that case, you just have to write the causes which you must have learned. Okay, so you just have to write 3 or 4 causes, and then you can write the interventions what you all can do. Okay, so second is nutritional assessment. Okay, so nutritional assessment, we can say nutritional assessment is half silent, and next we have to verbally say also. So in nutritional skills, make sure nutritional assessment, be aware of the formulas, like make sure that you read the formula as well as you go through that chart also. Mostly we get the charts. Okay, it's like 80, I cannot say, but mostly people, last previously also I asked my friends, they all got the chart only. But if they do not provide the chart, make sure that you are ready with the formulas also. Okay, and once you do it, just do it very fast, because nutritional assessment is for 8 minutes. So make sure that you finish it within 3-4 minutes. Okay, it's very easy. Step 1, step 2, step 3. Okay, once that is done, make sure that write the notes. No need to write full notes, just write it like type 1 how it is, type 2 you already know, right? Severe, mild. So according to that, just make the notes and like start with the description. Like you just have to tell the examiner that this patient is having severe, or the patient is like severe malnourished, or according to the condition, you just have to tell the examiner. Okay, so make sure that everything do it within 3 minutes, and then 2 minutes just prepare it, and then you can just do the verbal thing. Okay, make sure that while doing the thing, make sure that you double check. Okay, it's very important, because once you make the mistakes, then everything changes. Okay, the things are like in the severe malnutrition, everything is different. So be aware that whatever you do, double check it. If you take some amount of time in like doing documentation, that is totally fine. Okay, but make sure that you double check and then do it. Okay, third is oral care plan. I got oral care plan. So in my oral care plan, I got a patient who had a disability. So we had things like for oral care plan, what all things has to be done for the patient who has disability. So for disability also there are points. So they will, in my situation, they just gave a scenario where we have to read the scenario, and according to the scenario we just have to guess. Not like guess, it is very like obvious that patient is having drooling. Automatically it says that patient is having some disability. So it is very like they give a very easy format, or a very easy question. Okay, somehow the things which we have learned in oral care plan, like cancer care plan, we have got points, right? So among that one point, they are going to include such things in your question. So not to worry, it's very easy. Oral care plan, just make sure that just read those important points. Like in cancer thing, we just give oral thing every time, sips of water. So in that, they'll always like they'll write a question as patient was having dry mouth. So that is how you have to learn. Like you have to just make sure that you have to pick that point, and according to that you will be able to find out. And once you are able to find that thing, and after that you will be able to write it. Okay, so that is about oral care assessment. And last is pressure area assessment. Like I don't know what to say about pressure area assessment. Pressure area assessment is not difficult, but I can say it's more about how much you can solve. So if you will solve more, like it's better to go through pressure area assessment. That is what I can say, because the more you solve, the more you will able to understand what actually they are asking. Because somehow nutritional is the thing where we lack, like we tend to make mistakes. And impairment. Okay, these are the 2 points where we tend to make mistakes. So just be aware about pressure area assessment. Main is nutritional. Okay, make sure that you read each and everything about 1/3 quarters, everything. You just have to read, and according to that you have to mark it, and you have to write the pressure area assessment. Okay, like in the points you have to write. So make sure that you do it. Okay, so this was about silent skills. And one more is fluid balance. So in fluid balance, you just have to do the total. Make sure while totaling it, don't be in a hurry. Don't be in a hurry. We have a lot of time for fluid balance. It is almost 14 minutes. That means we have a lot of time. So make sure that you utilize your time. Okay, you already have got the question. Just make sure that you first do first column, finish it, and start with the second column. Like I would suggest, like my suggestion is keep on practicing and see which method suits you the best. According to that you do it. Because for me, like for people, the form which they like, for my friends, some other form was easy, but for me some other forms were easy. So you just keep on practicing. That is how we are going to understand what kind, like which form we can use just to make it like easy. Okay, so according to me, fluid balance is very easy. We will be getting a calculator. Not to worry, we'll get a calculator. While writing negative, positive, make sure that you write it in a capital form, positive. or else it is negative also, just write it in a capital form. Make sure that corrections, if you make any mistakes, you can like just cancel it. No need to scribble it, okay? No need to scribble it, you can just cancel it. But make sure that not to make such mistakes, because somehow we are like, I know, like lots of stress, but I can understand. But really I'm saying no need to stress much, like it's not at all difficult. Like it's we think a lot that it is very difficult, but it is not at all difficult, okay? It's all about confidence, and it is all about faith in yourself. Trust in God, trust in yourself. You all will definitely clear your ski in your first attempt, okay? All the best for your exams. And the thing is, if you need a live video, like if you want me to come live on TikTok, I'll just share the link, and one day we can just I'll just open a live, and then we can just have a chit chat. That is how we can clear the doubts. Okay, so I'll be just giving you my link, like TikTok link below, so that you can all follow me and keep on following. Like if you really like my video, if you have any kind of suggestion, give me, like write it on the comment box so that I can improve. Okay, so as I have told you about the prescription skills, silent skills, and next video will be on the non-prescription skills. Okay, so all the best for exams. I hope you all pass your ski on your first attempt. Thank you so much.